My Lords, this has been an extremely rich and informative debate on a rather diverse set of amendments. My contribution will be fairly brief, but I wanted to first reflect off the comments of the Noble Lord Scriven about the elephant in the room, and the Noble Lord was reflecting on many other contributions about the lack of real integration of health and social care in this bill, and that the way that this bill is essentially written for health. Now, I totally don't disagree with that identification of that elephant, but I do think there's a second giant creature in the room that's being ignored, perhaps let's call it a mammoth. That's the lack of adequate funding and the lack of adequate numbers of people for both health and social care. And that means that those silos are seeking to defend both their funding and the resources and reserve it for what they see as their core functions, and therefore find it very difficult to reach out and stretch into new areas, even where that would have huge net positive impacts overall. Now, just reflecting on a couple of other things, I do particularly want to heartily endorse the Noble Lord Farmer's call for, I'm not sure if he coined this term, but a reverse speeching for the NHS in terms of the reopening of community hospitals. I may indeed borrow that phrase if the Noble Lord doesn't mind in future. And I also want to comment on 51A in the name of the Noble Ladies Finlay and Jolly, about emergency services going to everyone in the area. And I see that the Noble Lord Davies of Brixton is now in his place, and this very much ties to an amendment the Noble Lord moved on Tuesday, and he told a tale then, which I won't repeat, about a case where someone was denied treatment that they desperately needed because of arguments of which area they were in, and this was a neighbouring area. And I think this is a huge potential problem from the structure that we're creating here that really has to be taken on board. And of course, Amendment 51A deals with the responsibility, but of course there also has to be the funds to go with that responsibility. And I also particularly want to commend, it hasn't got a lot of attention, but the Amendment 100 in the name of the Noble Lady Baroness Finlay, the duty to promote rehabilitation. Because I think when we're talking about the dramatic medical interventions, the high-profile stuff, there's just generally acknowledged, but sort of as always as an afterthought, that person who's had that big dramatic intervention, they're not going to be suddenly cured in most cases tomorrow. There's a long process of recovery. And indeed, putting on my reading list, it's been glowingly reviewed in many places, The Lost Art of Convalescence by Dr. Gavin Francis. And I think that's something we all should be thinking about a lot more. So I come finally to Amendment 110 in the name of the Noble Lady Baroness Mackintosh of Pickering, to which I attach my name, because as the Noble Lady said in her introduction, this is something, police bill, domestic abuse bill, we've been addressing again and again, but this is very acutely an NHS problem. And I just want to draw on an article from the Nursing Times on the 24th of December, and this is an account of a nurse who was called Claire in this article, who it was when she was actually going through a checklist with a patient, a checklist that had been provided by a charity. So this was not something extra added in from the outside, not core NHS, that she realised she herself was a victim of domestic abuse. She said yes to more of the questions than the patient had. And that really, I think, is a demonstration of what the Noble Lady Baroness Mackintosh said, that there's not the training given to medical professionals to see what's happening to themselves, to see what's happening to their patients. Maybe it's added in as an additional charity, someone's managed to get something into the system, but it's certainly not going to be there across the system. And I just want to note that, of course, we're doing this bill, we hope, although perhaps I'm not so certain, as the Noble Lord Hunt said, that we're doing this for the long term, but we have to note that this is happening in the context of the COVID-19 pandemic. And I note that the NHS sexual assault referral figures for the first half of 2020 were significantly dropped, and that also picks up a great deal of domestic abuse. Yet online searches for domestic abuse were up 350% in the same time period. So we have an NHS that's been forced to focus on the COVID-19 pandemic, often perhaps drawing away resources that might have have started to deal with domestic abuse anyway. We have got a huge rise in the problem. The moment we're at now, I believe it's crucial that domestic abuse is on the face